Welcome to Prescribing Lifestyle, the podcast that's all about empowering you to live your healthiest, happiest life. I'm your host, Dr. Avi Charlton, and each week we'll dive into the latest research, practical tips, and inspiring stories to help you optimize your well-being. From nutrition and fitness to mental health and mindfulness, we'll explore every aspect of lifestyle medicine, giving you the tools you need to make informed decisions and take control of your health. Whether you're looking into preventing disease, managing chronic conditions, or simply elevate your quality of life, Prescribing Lifestyle is here to guide you on your journey to wellness. So, sit back, relax, and get ready to embark on this transformative adventure towards a healthier, happier you. Let's dive in. Hello, welcome to another episode of Prescribing Lifestyle Podcast. Today, I'm going to talk about having a mental health plan and the benefits and importance of having a mental health plan. It is so relevant. We are trying to increase awareness around mental health and the need to have accessible support. There is so much need to be aware of looking after your mental health nowadays. So what is a mental health plan? In the Australian Medicare rules, a mental health plan is a structure or an approach that a GP writes up so a patient can have a plan on how to look after their mental health. Some patients think it's just a piece of paper or a referral so they can see a psychologist at a cheaper rate. However, a GP who is adequately trained in mental health can really help a patient to write up a good plan, a mental health plan, so a patient can prioritize what needs to be done and help to improve their mental health according to the plan. I am one of those GPs. I have done a level 1 mental health training many years ago. I can't even tell you when. So I can write up mental health plans easily, and I do it all the time, maybe a couple of times a day. And recently, actually maybe 3 weeks ago, I have completed a level 2 mental health training, which is called Focused Psychological Strategies. So I can help patients write up a more proper, a more thorough mental health plan. With the good mental health plan, a GP can assess the patient's needs, develop a plan, and discuss treatment options. There are lots of things we can do that can help prioritize our mental health, including consultations with a GP like myself, psychologist, a psychiatrist, and we can even have group therapy, which is so powerful because you'll be connected with like-minded individuals who are going through a similar journey or something very close to your heart. So what happens when you come in to a GP? I will assess if you're eligible to have a mental health plan. Under the Australian medical rules, you can have a mental health plan once every 12 months. So quite often I would look up the Medicare services and see if you've had a mental health plan before. Those with a mental health diagnosable mental disorder, according to the ICD-10, which is the international diagnostic criteria. For example, eligible conditions include depression, anxiety, PTSD, which is post-traumatic stress disorder, eating disorders, schizophrenia, bipolar disorders. And then there's things that you don't know that are actually diagnosable mental health conditions, which happens to many more people, like acute stress reaction. So, for example, some significant life-changing event or a stressful event that, for example, someone died in your family or you got separated with your partner, that can be a significant stressful life event. We can diagnose as an adjustment disorder, which will really benefit from a mental health plan to receive some psychological treatment. Things like acute stress reaction, that is another diagnosable ICD condition. An acute stress reaction, for example, something that happened to you, you might be stressed with work, you might have lots of things going on, or burnt out, or so panic disorders, heart rate very high, something that's stressful that's happening, acute crisis or fatigue, burnt out, crisis state. That is an acute stress reaction. That is also a diagnosable ICD-10 disorder. So if you have a diagnosable mental health condition, we as a GP can write a mental health plan for you. In my mental health plan, I assess your mental state. We describe some symptoms. I also discuss what other symptoms there is. For example, how's your sleep? How's your eating? How is your concentration? How you functioning at work? And we develop a goal setting, collaboratively setting realistic goals on how to improve your health. And then we have a strategy on a personalized plan on how to have resources and what specific actions to achieve these goals. We should have regular monitoring and adjustment. So running up a plan doesn't mean it's just given to you and you do whatever you want with the piece of paper. We should review your progress and make necessary adjustments to the plan. And I would get you to come back and review it in a few weeks. Sometimes medications are needed, and that can be helpful. With the mental health plan, within the Australian system, we can access 10 Medicare rebatable mental health services per year. These mental health services include visits to psychologists and GPs like myself who have trained in focused psychological strategies or level 2 mental health training. As I said before, I have spent a lot of hours, actually it's over 20 hours, obtaining this qualification, and I have obtained this qualification called the level 2 mental health training or focused psychological strategies. What these focused psychological strategies entail is these are techniques that have been approved by Medicare, and these techniques have lots of evidence that it does improve mental health. For example, psychoeducation, which includes motivational interviewing, cognitive behavioral therapy or CBT, a lot of people know what CBT is behavior modification, or talking about how we can use our behavior, how to change our cognitive function, on how to improve our mental health and improve our behavior. For example, CBT, how it can be used is, for example, someone might think with their eating is, I always overeat when I'm stressed because it's the only thing that makes me feel better. So a patient might say that to me, and he thinks he has to overeat and he's stressed and he can't stop it. A CBT approach to challenge this thinking is that I might ask him, are you sure this is the only way you can feel better, is to eat junk food and overeat? Let's explore what other ways you can do to manage your stress that doesn't involve food. Let's challenge that idea. Maybe there are other ways you can do to manage your stress rather than involve food. So those are the things that we can use, strategies using CBT on how we can challenge our thoughts, restructure negative thought patterns, and help to reframe what you can do when you have stressful situations. Another example is sometimes patients believe that if I eat one unhealthy meal, then I am off track. Then what is the whole point of continuing this journey? I have ruined it and I am a failure and I can't stay on track. I can't do this. Using a CBD technique, we can really challenge that idea. One healthy meal doesn't really undo all the progress. You can get back on track. One healthy meal doesn't define you. If you get back on track, that one unhealthy meal doesn't matter. If you enjoyed yourself, that is all that matters. You can get back on track straight away. It really doesn't define you. It doesn't ruin your life. So if you have you can get back on track the next day, upcoming meals, then it's really not a big deal. So that's using CBD techniques on how we can manage healthy eating habits. So other examples of focused psychological strategies is my new passion is talking about breathing. Controlled breathing or relaxation therapy is another evidence-based therapy to improve mental health. I've had so many patients that have retrained their breathing, they've taken up breathing exercises, and they have reaped the tremendous benefits. Most of these patients have found they are stressed or they have anxiety, panic attacks, and learning on techniques on how to control the breathing, especially when they have these panic attacks, and doing more of these breathing exercises can really help to improve them on managing their mental health. I've even had patients that do a breath work with me, and then we spend 15 or 20 minutes of the consultation time doing a breath work exercise. That these techniques really help with retraining mental health, and it is a recognized focused psychological strategy by Medicare, and you can use them as one of the mental health plan sessions. So when you have a mental health plan, you get 10 sessions that are rebatable by Medicare. You can use some of these sessions with the psychologists who will use lots of other techniques, and they are fantastic. And you can use some of the sessions to see me. We can practice motivational interviewing or CBT or controlled breathing techniques or talking about breathing retraining. And I believe this will revolutionize my practice because patients can actually get much more financial incentive, financial benefits through financial support through Medicare. So if you come in to see me for a 45-minute consultation, I haven't changed my billing. It's still the same cost, $330 for 45 minutes, but instead of $120 you get back from Medicare, you will get $150 back from Medicare, which is almost half of my charged consultation. If you book for a 30-minute consultation, I charge $220. Normally you would get back $80 odd, but with the mental health plan using one of the 10 sessions, you will get I can't even remember, $100 back from Medicare, which is a lot more. I did this training to help my patients prioritize their mental health, and with low-carb eating, healthy eating, managing your eating habits, and managing breathing, helping anxiety and stress, it is all related to mental health. So I would encourage you to think about obtaining a mental health plan If you don't have a GP, you're most welcome to come and see me, and I will build that consultation if I write a mental health plan for you. But if you have your regular GP, I would encourage you to go to your regular GP to obtain a mental health plan for a diagnosable ICD condition, such as an acute reaction or adjustment disorder or depression, anxiety. And you can use some of those 10 visits to come and see me, and we can harness the financial support offered by Medicare. In the future, I'm really hoping to have some group breathwork workshops. Using those group workshops, we can also harness the Medicare support system. With the mental health plan, you can get 10 sessions individually to see either a psychologist or a GP trained in this, like myself. And you can have 10 sessions with the groups session under the mental health plan to get rebates varying between $150 to $180 in a group setting. So when I get my head around, I will organize some group breathwork workshops, and we can do it in a group, and we can harness the power of group breathwork therapy, and we can all support each other, and that will be amazing. I hope you enjoyed this episode of Prescribing Lifestyle and you found this information informative. If you have any questions about mental health plans and a GP and how you can see me, please reach out to see me or contact me on email or private message, and I will explain to you how you can use your mental health plan to see me and or a psychologist and maybe some group sessions in the future. Remember, if you don't look after yourself, you can't look after anybody else. I hope you enjoyed this episode of Prescribing Lifestyle. Until next time, stay tuned. Thank you. Thank you for tuning in to another episode of Prescribing Lifestyle Podcast. Before we wrap up, I have an exciting news to share. I have a new ebook called Low Carb Made Easy. It's now available. This guide is perfect for anyone looking to dive into the low carb lifestyle. Inside, you'll find the basic theory behind low carb eating, a detailed food list, practical meal plan, and a variety of delicious recipes. It's designed to make a journey to better health easier, simpler, and enjoyable. For those who prefer a hard copy, head over to my website and register your interest using the link provided. My website is www.mlcclinic.com.au. Head to online store. Remember, the information shared in this podcast, it's for educational purposes only and not proper medical advice. Always consult your medical professional before making any changes to your lifestyle and diet, or you can come and see me in Melbourne Low Carb Clinic. If you enjoyed this episode, don't forget to subscribe, leave a review, and stay connected with us on social media. Your feedback will help us improve and reach more listeners. Lastly, if you found this episode helpful, please share it with your friends and family. Together, we can make a positive impact to our health and our communities. Thanks again for listening, and as always, stay healthy and happy. Until next time.